The most important thing about infantile or toddler acne is simply to recognize it and diagnose it and initiate treatment. Because so often I see little kids with infantile acne that have been told that it's just baby acne, that it will go away, that it doesn't require any treatment. And infantile acne is different from baby acne. Baby acne happens the first 3 months of life, spontaneously resolves, does not require treatment, easy peasy. Infantile or toddler acne is a different story. It starts between the ages of 6 months and 18 months, and it has the potential to cause scarring. So we want to treat infantile acne. So the most important thing is just recognize that it's there, diagnose it, and then initiate treatment. We typically use topicals to treat infantile acne. I will typically start with clindamycin lotion. I start with that because it's simple, it's cheap, it's well covered by insurance. It's one of the rare circumstances where I'm using clindamycin lotion all by itself. But in this particular clinical situation, I think it's a nice choice. If that doesn't work, then I will typically switch to a benzoyl peroxide clindamycin combo or consider over-the-counter adapalene. If that doesn't work, then I think even stronger topicals, consider adding oral antibiotics, and in rare circumstances, even isotretinoin can be used for toddler acne, again because of the potential for scarring. Acne is happening at younger and younger ages. It used to be abnormal to have acne before the age of 9. Now it's only abnormal before the age of 7. And it's because puberty is happening at younger ages too, and there are a lot of different theories about why that is. But we know that we can expect to see acne at younger ages. If you do see a patient that had onset of acne between the ages of 3 and 7, you do want to put them through a little bit of a workup, just checking some hormonal labs or sending to a pediatric endocrinologist to make sure there's nothing else underlying that issue. If the acne started once the patient was 7 or above, then you can go ahead and initiate treatment. Treatment can get a little bit complicated in the younger kids because so few medications are approved in that age group. Most acne medicines are approved age 12 and up. There's a sprinkle of them. Some of the newer ones have been approved age 9 and up because, again, we're recognizing this trend of acne happening earlier. But if you are dealing with a patient who's 7, who's 8, there's virtually nothing officially on label to treat their acne. So you're reaching for generic medications that tend to be cheap and affordable, things like topical clindamycin, topical adapalene, topical tretinoin. Those are the sorts of things that you're going to reach for in that situation. As they get a little bit older, you have many more options to consider, and so the choices become numerous after a certain age. In my experience, I've had a handful of patients who develop acne where they're on an oral JAK inhibitor for things like atopic dermatitis or alopecia areata, and most of them have a preceding history of acne. So it's kind of a mild, maybe simmering issue, and then they go on the JAK inhibitor and they develop more acne. Another clinical situation that I've observed is a patient with no prior history of acne, and then all of a sudden they're on the JAK inhibitor and boom, now they have acne. In both circumstances, I'm likely to manage it the same way, and I really manage acne in the same way I manage any other acne patient. I consider topicals, I consider oral antibiotics for short periods, I consider hormonal options like birth control pills and spironolactone, and I will even consider something like isotretinoin depending on level of severity.